Good afternoon and welcome to today's presentation on corrective exercise. My name is Rod. I'm the Wellness Program Coordinator for the City of Gainesville, and I am the Director of Pro Club. This is the first presentation in our Summer Health Series, and it is entitled Corrective Exercise, and today we'll be specifically talking about cervical spine impairments. Corrective exercise is a process that many health and fitness professionals are utilizing to recorrect dysfunction in the body. It is used by physical therapists, athletic trainers, personal trainers, and it has shown to be very effective. It is based on scientific research, and it is something that I came across years ago and learned about. And since then, I have been learning and implementing with our employees. And so far, we've been getting really good results. So let's start off with a definition of what corrective exercise is. Corrective exercise is the process of identifying neuromuscular dysfunction, creating a plan of action, and implementing an effective corrective exercise program. The human movement system that you'll hear me refer to quite often during this presentation consists of the nervous system, the muscular system, and the skeletal system. So it's the part of your body that enables you to move around and do the things that you do each day. And it is a very complex, well-organized system of interrelated and interdependent myofascial, neuromuscular, and articular components. But it makes sense, right? The nerves cause the muscles to contract, and the muscles enable the bones to move. So that's really what we're talking about here. And it's the functional integration of each of these components that allows for efficiency during functional activities or daily activities. So it is easy for dysfunction to occur. It can happen over time. It can happen from just bending over, picking up a piece of trash, sweeping the floor. It can even come from repetitive movement like swimming or sitting at your desk for long periods of time, staring at the monitor with incorrect posture. So it's easy for things to get out of alignment. This information is going to help you to get things back into alignment or even to maintain the good alignment that you have. And that's ideal for any one of us. If you really think about it, just utilize an example that we just mentioned about sitting at a desk in front of a computer with poor posture. What happens is over time, the body starts to adapt to that position. And so certain muscles get shorter or tighter and other muscles get weaker. And the thing that we have to realize is that everything's interrelated and interdependent. So no muscle works independently of itself. They work in groups. So if one muscle is too tight, then the partnering muscle is going to be probably too loose and too weak. And so that in itself is going to throw off that relationship. Just imagine being at work. You work with other people. And let's just say you come to work on time, you do your job, but your coworker, I don't know, takes days off, maybe when they shouldn't. They come in late, and even when they come in, they really don't, do the work that they should do, like they should do it. So the thing that's going to happen is you're going to get more frustrated because more work is going to be on you. So you're going to be more stressed out. All right. You're going to be more uptight. You're going to be a little bit more cranky. And that's exactly what happens with our body, with our muscles in particular. All right. So they work together and they're interdependent and they rely on each other to do or to turn on and turn off when they're supposed to. So they're relying on each other for support. And when that relationship is thrown off, then things can happen in terms of we start getting a little pain, we start getting some aches, we start getting some inflammation, and that can develop into an injury. So what we want to do is we want to try to maintain a good relationship with all of our muscles, with the nerves. Again, back to the human movement focus. with our nerves, our muscles, our joints, because it's all interconnected. And so we would prevent dysfunction. But again, life happens, and sometimes things get out of alignment. And so again, this is going to help us to maintain that. So what we want is efficiency and longevity. Efficiency and longevity of the human movement system requires integration of all the systems. It requires communication. So if these muscles, the nerves are all communicating like they should, we should have no problem with being efficient, or with our system being efficient and increasing the longevity. We all want that. Okay. But there are things that we're going to have to do in order to maintain that. So what I want to do is get this information into the hands of our employees, so that they can do, or you all can do, a better job in maintaining your personal health, increasing your efficiency, and increasing your longevity. So think of it as another type of exercise. There is strength training, there is cardiovascular training, there is flexibility training that lots of people don't do. But nevertheless, those things are important. And so what I am saying to you today is to consider corrective exercise, because it is just as important. According to the information that I have read, dysfunction is on the rise. So injuries, people are going to see healthcare providers for injuries at an increased rate. So another reason why corrective exercise is so important. And really, one of the main reasons for this is because we're becoming more deconditioned as a society. We don't move around as much as we used to. We don't exercise as much as we should. And so that number will continue to go up unless we do something about it. So what happens is we get into what's called the cumulative injury cycle. So let me explain this a little further. The cumulative injury cycle is a cycle that we could all find ourselves in at some point or another. This is something that could start as a repetitive movement, or being in an awkward body position for any lengthy period of time. We could find ourselves in what's called the cumulative injury cycle for many different reasons. It could start from a repetitive movement. It could start from being in an awkward body position, or again, sitting at your desk for long periods of time in a bad body position. It could start accidentally by bumping into something, or stepping on a hard object with no shoes on. It could be anything. Wearing tight shoes, wearing high-heeled shoes. It could be a strain or a sprain or anything like that. But the thing is, sometimes we ignore these pain symptoms for long periods of time until they become intolerable. And then what happens is they develop into something more serious. So again, there's some sort of tissue trauma that occurs, as I just explained. And then we know that something has happened because we feel the pain. There is inflammation that's involved. After inflammation, the muscles begin to spasm. We've all heard of trigger points or knots in the muscles. And usually it doesn't stop there. It moves on to adhesions in the body. So now the muscles are kind of sticking together, and you don't have that range of motion maybe that you used to have. And then from there it progresses to what's called altered neuromuscular control. And so now again, the muscles aren't working as well together as they should for a particular movement. And then we end up having a muscle imbalance. Okay. And then if we never get out of this cycle, it just continues over and over again. So you have some sort of injury, you have the pain, you have a muscle spasm or a knot, or lots of tightness and stiffness in the muscle, and it just progresses, and the symptoms may come and go, and then over time, again, they'll get worse and worse until you can't maybe tolerate anymore. Then you have to go see your doctor. You may have to get surgery. You may take medications, et cetera, et cetera. And so that's what we deal with on a daily basis. That's what many people deal with on a daily basis. According to a statistical survey that was done by the National Institute of Health Statistics, it indicated that neck pain is the third most common type of pain, and that 2/3 of the population will experience it in their lifetime. So many people suffer from neck pain, but again, sometimes we don't know what to do with it. We just kind of tolerate it, and then when we can't tolerate it, then we go to a physician who may then just offer us medication and may only treat the symptoms and not the problem. So let's talk about the neck. Let's talk about neck pain. That's what we're really here to focus on. The cervical spine is made up of 7 cervical discs. But really what I want you to see is the complexity of the neck. I mean, it's a highway that many nerves and muscles go through. So now in taking a look at the musculature of the neck, you can see that there are layers of muscles in the neck that go every which way. So any one of these muscles can show signs of dysfunction. It could be the deeper muscles of the neck. It could be the more superficial, larger muscles of the neck. It can be any one of them. But if you've ever had a tight neck or a stiff neck, you know how painful and aggravating it is. And I want to talk about some ways a little bit later and how you can kind of deal with this, because it is very, very common. What I'm showing you here are some of the primary muscles in the neck. So we have the levators, scapulae, we have the rhomboids, we have trapezius, which are often tight, the sternocleidomastoid, which is often also tight, the scalenes usually get tight, cervical erector spinae, suboccipitals, deep cervical flexors. These are muscles that typically are tight. Rhomboids can usually get underactive, but again, it's in relation to what's going on either above it or below it. So at this point, I want you to kind of see yourself, because these are some common complaints that we normally have, especially when there's neck dysfunction. Usually, and many times, I should say, there are headaches. Dizziness could be one of the symptoms, becoming lightheaded. Neck stiffness, certainly. Neck pain or radiating pain. And sometimes the pain that we may feel may be down into the shoulders, because that's really where the neck region ends, down around the shoulder blade or level with the shoulder blade region. So it's not just in the neck itself, but it actually goes down a little bit lower than what we typically think what the neck is. So if you've experienced any one of these symptoms, I'm not suggesting that it's solely due to neck dysfunction. It could be something else, but especially if it's something structural, then corrective exercise really won't be a benefit. Certainly you'll need to see your doctor about that, but many times that's where we need to start. We need to start to see if we have the tight, what muscles are tight, and what is the source of this dysfunction. Why am I having neck pain? Why is my neck stiff? Why am I having dizziness? Certainly, again, it could be a symptom of something more serious, but many times it's not. 2 key muscles in the neck that I wanted to highlight today were the longus colli and longus capitis. These are 2 primary deep neck flexors. They play a major role in the stability of the neck in all positions. The action of these 2 muscles includes nodding of the chin. So it's that chin tuck position that many of us have trouble with, especially when we're sitting for long periods of time. Going back to my example with sitting at the computer. For for hours at a time. So we're sitting there at the computer, looking at the computer, and we may start out with good posture, but then we'll end up with a forward head posture and rounded shoulders, which in itself is a bad alignment for the neck and the shoulders. So what I want to do is encourage you all in that proper head and neck alignment and shoulder alignment, so that we don't create dysfunction on our own. Proper alignment is key, because when the neck and shoulder muscles get out of alignment, this increases the stress on the cervical spine, and it could lead to injury. This slide illustrates where your head goes, your body will follow. This person is demonstrating obviously poor posture, in which he obviously has static malalignment, because his spine is rounded at the shoulder and neck. And so obviously there is going to be more increased stress on the cervical spine, but as well as on the thoracic spine. So because of this rounded posture, the second picture here, as you can see that the head now weighs 32 pounds versus just 12 pounds when it is in proper alignment. And so lots of things happen as a result of this. The static malalignment that this person is demonstrating eventually is going to cause some what we call altered normal length tension relationships in the muscles. So basically this leads to joint hypomobility, in which the muscles around the joints begin to tighten up, and eventually could lead to muscle spasms. We know that as trigger points or knots in the muscles. But this occurs to minimize the stress at each of the particular segments of the spine in this unnatural position. So the body, being as resilient as it is really trying to protect itself from further damage. And so what's happening is the body is out of balance. The relationships are off between the muscles, groups of muscles, and the joints. And so now we have certain muscles that are overworking and certain muscles that are underworking. So this imbalance in itself will cause us pain and discomfort. And again, what we have to remember is that no one muscle is an island. They work together. So when one muscle gets out of whack, that causes other muscles to also become out of whack. And so now we're having pain not only in the neck, but it can also easily lead to shoulder problems, such as rotator cuff impingement, shoulder instability, biceps tendonitis, headaches, and other symptoms. It's important that we know how these postural imbalances occur, so that we can understand how to avoid the cumulative effects of poor posture. So on this slide, I've listed 5 ways in which postural imbalances occur. Number 1 being habitual movement patterns. So the things that we do each day. For example, if you are an office worker and for your job you have to sit most of the day in front of a computer, then you're going to develop certain habitual movement patterns in that regard. Number 2, altered movement patterns from repetitive movements. So what if you are a construction worker and you do a lot of overhead movements? So certainly you're going to have muscles that are overused and that become tightened over time, and certainly can cause you some pain and discomfort. Number 3, altered movement patterns from an injury. Obviously, when there is an injury, the body will find a way to compensate to continue to be able to do a certain movements. And so what happens is there is a cumulative effect in regards to how we move due to the dysfunction that's occurring from that injury. Number 4, altered movement patterns from surgery. So there is damage that is done to the tissues in any form of surgery, and many times the body recovers, but sometimes it does not fully recover from the surgery. That in itself can cause us to develop certain muscle imbalances. Number 5, altered movement patterns from incomplete rehabilitated injuries. After an injury, there's a significant loss of function and that needs to be restored. So even post-rehab, my suggestion is that you continue to do your rehabilitation exercises to maintain muscle balance. So at the end of the day, we all want and need optimal neuromuscular efficiency. So now let's talk about how we can do that through corrective exercise. Phase 1 of the corrective exercise continuum is inhibition. The goal of phase 1 is to release tension and decrease activity of overactive neuromyofascial tissue. And there are different or several different devices that can be used. Number 1 is a Theracane. Number 2, a foam roller. Number 3, a lacrosse ball, golf ball, tennis ball, any kind of handheld rollers. Or there's also dowel rods that can be used to help to decrease the overactive tissue that you have. And that's basically the tightness that you feel in the muscles. The key is to hold pressure on the tender area or trigger point for a sustained period of time, depending on your level of sensitivity, so that your trigger point activity can be diminished. Research indicates self-myofascial release exercises significantly reduce trigger point sensitivity and increase range of motion when applied in conjunction with stretching. So there are definitely positive physiological effects of self-myofascial release in the muscle tissue. The research is showing that there is increased vasodilation. So in other words, there's more oxygen and nutrients that are being pumped through those muscle tissues. There's more removal of waste products, tissue recovery and repair, better viscosity, changes in the tissue for better overall muscle contraction and joint function. So there are several different benefits of it. You'll see more and more athletes using self-myofascial release, for example, like before a big match. So it's an activity that you can do before you work out and even after you work out. So you can do it before and or after. You don't really have to feel limited in terms of when you do it. It's something that you can do each day for as long as you want, again, depending on your tolerance level for it. Just remember that there will be some discomfort while you're foam rolling, but keep in mind it's tension leaving the body. Phase 2 is the lengthening phase. The goal of phase 2 is to increase the extensibility, length, and range of motion of the muscle tissues in the body. And it's accomplished by various stretching techniques, the most common one being static stretching. Static stretching combines low force with long duration. And with static stretching, you hold the stretch at the first point of tension for up to 30 seconds. The other important thing that I want to mention is that when you're stretching, you shouldn't be stretching to the point where you actually feel pain. Now, mild discomfort is okay, but if you're stretching to the point where you're actually having pain, then that means you're stretching too far. There is also another type of stretching. It's called neuromuscular stretching. However, this type of stretching is a little more advanced. Phase 3 is the activation phase. The goal of this phase is used to re-educate and increase the activation of underactive muscles in the body via isolated strengthening exercises, or positional isometrics. Let's review. In phase 1, we decrease the overactivity of the muscles. In phase 2, we restored proper range of motion. In phase 3, we've reactivated the underactive muscle tissues. And now in phase 4, we're going to reintegrate the muscles to facilitate their working together through the use of dynamic movements. So through the use of the corrective exercise process, we'll be able to restore the muscle balance that we may have lost through poor posture, static malalignments, and even dynamic movement compensations. I encourage you to give corrective exercise a try. Not only will it help to restore proper movement efficiency, but also you'll experience the long-term benefits of decreased risk of injury, improved performance of daily activities, increased longevity, and improved quality of life.